Ever contemplated in the intricacies of your development within the protective confines of your mother's womb? Today, we embark on an exploration of prenatal development, delving deep into the fascinating journey from conception to birth. Join us as we unravel the stages germinal, embryonic, and fetal that shape and mold the remarkable process of human development before entering the world. For our objectives, by the end of this presentation, students will be able to first, recognize and comprehend common prenatal development hazards and their effects on fetal health, empowering them to make informed choices during pregnancy. Second is to identify common hazards and risks that affect children and adolescents. And third is to provide a summary of key developmental milestones and challenges during childhood and adolescence. Now, let's proceed to the processes and stages of prenatal development. How did we become to be who we are? A question we all probably have asked our parents when we were still a child, and according to them, we, all of us, came from a mother's stomach. It is an ambiguous response, but true. Now let's take a look at this photo. As we grow older, it became clearer that it all started from our parents' copulation. As our science teacher have explained to us that it is due to the male sperm cell, which is indicated in that blue circle, and a female ovum, which we can see in that green circle, which we combine together during fertilization in our mother's fallopian tube to develop a zygote. And this marks the beginning of the germinal period. Germinal period. During this stage, notice that the zygote begins its journey down to the uterus over the course of about 1 week. During this journey, the zygote divides many times from 2-cell stage to 4-cell stage up to 32-cell stage. In addition, during the first three divisions, the cell size doesn't change, but the cell number has increased. After the first week of germinal stage, a blastocyst is then formed. During the second week of the germinal stage, the blastocyst establishes itself in the uterine lining through implantation. Moving on to the embryonic stage. The embryonic stage lasts from about the third week of pregnancy until the eighth week of pregnancy. It begins after the blastocyst is completely implanted in the uterine wall. During this stage, as we can see here in the photo, the blastocyst finally begins to take on distinct human characteristics. The head, eyes, heart bulge, hand, and leg bud are starting to take form. It is now called an embryo. By the end of the eighth week, most of the embryo's organs and system take shape. Lastly, let's talk about the fetal stage, which takes place during 9 to 40 weeks of pregnancy. The fetal stage of development begins around the ninth week and lasts until birth. This is when the embryo officially turns into a fetus. The fetus' major organ and body system continue to grow and mature, like for example in that picture, from 9 weeks to 12 weeks, 16 weeks, which is a fingers and toes development, and up to 40 weeks, which is a full term development. The fetus is able to move its limbs, although you may not feel it until 20 weeks of pregnancy. The majority of the growth in both weight and length happens in the fetal stage. In summary, prenatal development stages starts from the zygote, which was divided due to the metasis becoming a blastocyst, which is then implanted in the uterine lining for about 2 weeks. During the third week, it becomes an embryo. In this stage, body parts are starting to develop. Finally, the fetal stage. Here the embryo becomes a fetus. Major developments are taking place, and at week 40, it's ready to born because there's not much space left inside the mom. Most common hazards to prenatal development. It is essential that fetus will receive good prenatal care, with it being most at risk for some of the most severe problems during the first 3 months of development. Unfortunately, most women at this time are unaware of their pregnancy. It is estimated that 10% of all birth defects are caused by prenatal exposure to teratogen. So, what are teratogens? Teratogens are substances that may produce physical or functional defects in the human embryo or fetus after the pregnant woman is exposed to the substance. Alcohol and cocaine are examples of such substances. Exposure to the teratogen affects the fetus or embryo in a variety of ways. Now, let's break down some of the common teratogens. First, we have alcohol. Alcohol consumption may lead to neurocognitive and behavioral difficulties that can last a lifetime. It is recommended that women of childbearing age take great caution against drinking alcohol when not using birth control and when pregnant. The scary part about excessive consumption of alcohol is that it can lead to fatal death or may result in fatal alcohol spectrum disorders, or what we call FASD. It is a terminology used for effects of exposure to alcohol and replaces the term fatal alcohol syndrome. Heavy drinking by pregnant women results to the so-called fetal alcohol syndrome, or FAS, which is a cluster of abnormalities that appears in the children of mothers who drink alcohol heavily during pregnancy, and it is according to Centrock 2002. So, here is a photo of a child with fetal alcohol syndrome. Children with FASD have common physical features such as flattened noses, small eye openings, small heads, intellectual development delays, and behavioral problems. They are more at risk for lifelong problems such as criminal behavior, psychiatric problems, and unemployment. Let's proceed to the second teratogen, which is the tobacco. Smoking has been associated with low birth weight, placenta previa, birth defects, preterm delivery, fetal growth restriction, and sudden infant death syndrome. When a pregnant woman smokes, the nicotine travels through the placenta to the fetus. The fetus then experiences a reduction in blood oxygen levels. In fact, study also revealed that fetal and neonatal death are higher among smoking mothers. There are also higher incidences of preterm birth and lower birth weights among children with smoking mothers. Let's now proceed to the third one. Third most common teratogen are drugs like marijuana, cocaine, ecstasy, and other amphetamines. And heroin can cause low birth weight, withdrawal symptoms, birth defects, or learning or behavior problems. Let's take a closer look of these pictures of babies affected by cocaine during prenatal period. Cocaine exposure during prenatal development is associated with reduced birth weight, length, and head circumference, impaired motor development, and poor attention skills. Finally, let's talk about how environmental chemicals affect the prenatal development of a child. Environmental chemicals can include pollution, organic mercury compounds, herbicides, and industrial solvents. Some environmental pollutants of major concern include lead poisoning, which is connected with low birth weight and slowed neurological development. Radiation is another environmental hazard that a pregnant woman must be aware of. If a woman is exposed to radiation, particularly during the first 3 months of pregnancy, the child may suffer some congenital deformities. There are also an increased risk of miscarriage and stillbirth. A pregnant woman exposure to mercury can lead to physical deformities and intellectual disabilities. Sexually transmitted disease. Alright, let us talk about how STI can affect people who are pregnant and the little ones growing inside them. STI stands for sexually transmitted infection. These are infections usually passed on through sexual activities like vaginal, anal, or oral sex. That is why it's super important to people to be careful and practice safe sex to steer clear of these tricky infections. They are caused by bacteria, viruses, or parasites. What makes it tough is that some STIs cannot be cured at the moment, like HIV. Now, STIs can have serious consequences for both pregnant individuals and developing fetuses, to be transmitted from the pregnant person to the fetus during pregnancy or delivery, leading to various complications like premature birth, low birth weight. Infections like syphilis can cause congenital disabilities and birth defects in a developing fetus. Some STIs can be transmitted to the newborn during delivery, leading to neonatal infections. This can result in serious health problems for the infant. In some cases, STIs may increase the risk of miscarriage or stillbirth. That is why pregnant individuals must undergo regular prenatal care, including STI screening and treatment. If necessary, to reduce the risk associated with these infections. If you have any specific concern or questions, it is always best to consult with a healthcare professional for personalized and advice and guidance. In the figure, we can see how different aspects affect the prenatal development of a child. One of these is maternal disease, in which during pregnancy can have significant implications for both the mother and the developing fetus. Various health conditions can impact pregnancy, ranging from pre existing chronic diseases to conditions that arise during gestation. For example, maternal infections, especially those that can cross the placenta, may directly affect the fetus. Infections such as rubella, cytomegalovirus, or toxoplasmosis can cause congenital abnormalities, developmental delays, or other complications. Certain maternal diseases, such as gestational diabetes or thyroid disorders, can lead to hormonal imbalances. These imbalances may interfere with the normal development of the fetal organs and systems, increasing the risk of birth complications and long term health issues. Now, when we talk about stress, it is the physiological and psychological response of the body and mind to perceive threat or challenge. This response is orchestrated by the activation of the body's stress response system, which involves the release of hormones such as cortisol and adrenaline. It's essential for pregnant individuals to manage stress through healthy coping mechanisms, as a supportive and calm environment can positively influence both maternal and fetal well being. Maternal stress can potentially impact the developing baby in various ways. High levels of stress during pregnancy have been associated with an increased risk of preterm birth and low birth weight. Additionally, exposure to stress hormones in the womb may affect the baby developing brain and contribute to long-term behavioral and emotional issues. The prenatal development process involving germinal, embryonic, and fetal stages is crucial for a healthy fetus. However, it is vulnerable to hazards like teratogens, maternal health issues, and genetic factors. To ensure a healthy fetus, expectant mothers should receive proper care, maintain a balanced diet, avoid harmful substances, and stay informed about potential risks.